Bulavinaka and welcome to this episode of Nation's Business. On this show, we follow the Minister for Health and Medical Services on his tour of Naitasiri, Namosi and the Banga medical facilities where he met with staff and members of the community. This was also an opportunity for the Minister to assess service quality and delivery on the ground. All that and more are coming up in the next half hour. The Minister responsible for Health and Medical Services, Honorable Attorney Lalambalavu, toured the province of Naitasiri to visit health facilities. The tour allows the Health Minister to personally assess the state of healthcare infrastructures, identifies trends, weaknesses, and areas in need of improvement. By visiting these areas, the Minister also gained first-hand insight into the unique health challenges faced by the population in rural and remote areas. The Minister began his tour at the Namosi nursing station, where he met with nurses who are tasked with improving access to healthcare services and ensuring that residents have local and timely assistance without the need for extensive travel to urban centers. Nurses in rural nursing stations are often the primary healthcare providers, offering essential services, preventive care, and early intervention for common health issues. They also play a critical role in emergency response, providing immediate care in urgent situations before patients can be transferred to larger healthcare facilities. Having nurses in rural areas such as Namosi ensures continuity of care for individuals with chronic conditions, promoting regular checkups and monitoring to manage health conditions effectively. The Minister's presence in these areas sends a powerful message of government commitment to the health and well-being of all citizens, regardless of their geographical location.
And we've identified some of the challenges that the people here face, an ongoing challenge, which I believe is unique for this area. And what the ministry is currently doing is improving its infrastructure, improving the welfare for our staff who are mending these infrastructures. And again, I take my hats off to people who are our staff serving in this community. The challenge that they go through together with the Vanua people within the Namosi, and it's amazing to come and not only witness and experience firsthand the challenge that they go through on a daily basis in terms of seeking medical care and healthcare in general. So again, it's something for the ministry to look into, especially the challenges and how to address those challenges. This is some sort of a fact-finding mission for the ministry, especially my role as the minister, is to come and witness and see firsthand the facilities, the staff that man the facilities, the experience that they go through on a daily basis in terms of delivering quality health care.
The tour enables the Minister to evaluate the quality of healthcare service provided in remote areas, ensuring that residents receive adequate service.
Muna may be so kita matin to tamadal din pula pada ministry wa RF ni bisi orang mantai. Karena dia bendam dia bisa so na bisa. Na sana Naitasiri sa labo timai. Altonga mai nagu dawa de consule vitana. Lembro sangai terei lumen mugo. Kalau observasi mene don matu el rai. Vai lá era dende no estava na Verona. Na muni sasanga muni rawatan muni na laobai na bingkaran sampai bulan. Ano indo pa rongo kasi pawili ana itu ni matentu na budget senge paiste ko chikango na reida ni tosa texar na yuli ni lavo isuli wana tabanyu. Tosa dengo na sangai me na binatek na kono ni bingarabi wali wai hal sianta wali pula sangai me na binatek na raon ira ciubina ko ira bingarabi wili ina toi na bombo nasi na wawal tay binaka ni yo chichona ba ni baibo ni matentungo sana sangay na may babinatag ng papale wali ni waliway bingkarab to bigyan ni sa wala mabir na ando ni bingkarab sangay talaga mera Karena oira, risau na somero ralaw sa lusia na tu sa nga gagawin talmay. Ena wana nanu, ni binacho irungo, karabina irungo na naratalan ng karabina irungo. Ito tao sa nutanya na day maro ito anong to waliway, anong dimbay, ena palisis. Oni na rital juga na was-was ni lavo ko Ski tenchu men ena sangay mena uteni mena bingkara mena walimbulilog na kumibabo lang bigyan niya. Nadan outfits. Nga sa nangay juga nung tutubo na rilintay ka na division. Mga nagabak itong sabi na. Sangay talchukan na kakapatake na bingkarabi, kakabuli, kakataliswa willing to na lang outreach. Chiki ni tubo-tubo ka pailabo, matentu, yan talaga tubo-tubo sa biuto to na tamatala ni bulan.
Such tours by the Health Minister play a vital role in promoting health equity, ensuring that healthcare services reach even the most remote corners of the country and aligning policies with the actual needs of the population on the ground.
Again, I'm very thankful to the Namo and to the staff that do serve in these facilities under the Ministry of Health, especially, and I thank the SDMO of Banga for their assistance in allowing us to come over and have this field visit. And it was an eye-opener and something that we can go back and see how best we can address issues with regards to the challenges that are being raised by the community.
On his tour of Namosi, the Minister for Health and Medical Services began his visit at Waivaka Nursing Station, meeting health staff on the ground and getting insights to assist in more informed resource allocation and strategic planning to boost healthcare delivery. The minister met with nurses who have become an integral part of the rural communities in Namosi, fostering trust and understanding of local health needs through engagement.
today was no different than that. Coming up to the interior of Namosi to come and again see firsthand and experience and meet our staff, look at the facilities that they serve in and the challenges that they face, and trying and going back, see how the ministry can address those challenges that are raised by our staff that do man these facilities in giving out services of the Ministry of Health, providing health care to the people of Namosi. Today we visited 3 nursing stations so far, and it was again very, very thankful to the Central Division, the Divisional Medical Officer and his team for allowing us to come over and visit the area. And again, during the visit, we noticed firsthand the experience and the challenges that the staff mending the facility, providing healthcare, and also the people that are seeking healthcare. So again, I'm very thankful to have this opportunity to come up and to the interior of Namosi and experience firsthand what everyone is, the ministry is going through, especially in providing healthcare to the people of the interior of Namosi.
Engaging with local communities during these visits allows the minister to promote public health awareness, address health concerns, and encourage preventive measures tailored to the specific needs of the population. The minister acknowledged the partnership shown by the medical staff with the people of Namosi as he hopes to improve and work on the existing partnership.
The participation and involvement of the Vanua, especially here in the interior of Namosi, is very important with regards to healthcare delivery. Not only that, with infrastructure and healthcare delivery, Ministry of Health and the Vanua, especially the interior of Namosi, they have a role to play and we have a role to play. So it is you can say a partnership that we look forward to strengthening that partnership so that we can improve the healthcare delivery and also the health-seeking behavior of the people of the interior of Namosi. And so far, what we've shared with the community and the response have been positive, and we look forward to strengthening that partnership as we go on. And again, in terms of budgetary allocations, we are very thankful that the budgetary allocations for this year in terms of outreach, especially to hard-to-reach places, hard-to-reach communities such as this, is those allocations will allow the Ministry of Health to provide the services and in that sense provide universal health coverage to hard-to-reach areas. So again, we looking forward to that partnership and looking forward to utilizing the budget for the outreach programs. Not only that, there are other things that the ministry can work in relation with the Vanua, the people of the interior of Namosi, and other areas that we have visited and probably will be visiting in the next next this financial year.
With the Minister for Health and Medical Services visiting rural and remote areas such as Namosi demonstrates a commitment to understanding the unique challenges these communities face. This approach ensures a more targeted and effective strategy for improving health access and outcomes in the interior of Viti Levu, Vanua Levu, and Maritime Islands.
Part of that the experience coming up to the interior of Namosi was firstly to experience the road conditions coming up and crossing the bridges, crossing the rivers, and just sitting down with them and experiencing firsthand what they go through in terms of seeking health care. And if the road is not good, if the bridges are not good, then it hinders their health-seeking behavior in reaching the health care. So even though those part of the infrastructure are not under the Ministry of Health, but we will be liaising with the relevant ministries on how they can improve that, so it will allow the people to have easy access to their respective health centers, nursing stations, or health facilities that do look after them. So again, it's an important determinant, especially roads. And coming up to the interior of Namosi, I can say that still room for improvement in terms of our road conditions, and I believe we will improve on that in this financial year.
A visit by the Minister of Health to an island is crucial as it allows for a first-hand assessment of service delivery and challenges faced by both healthcare staff and community members. Honorable Attorney Lalambalavu visited two of Banga's health facilities, the Banga Health Center located at Banga and the Ravi Ravi Nursing Station. The Minister for Health and Medical Services began his Banga tour at the Banga facility. Accompanying him was the Permanent Secretary of Health at the time and senior health officials. The team met with the doctor in charge and his staff, and they were updated on the status and service delivery at the facility.
The minister's visit today it's quite encouraging, very empowering. It's filled with promises that we know that we have been considered in terms of service delivery. There are quite a few challenges our minister had came and addressed.
Climate change poses a significant threat to health facilities in maritime islands. impacting infrastructure, staff safety, and overall healthcare delivery. Rising sea levels and extreme weather events can strain resources and disrupt services. According to the visiting health officials, mitigating these effects involves implementing climate-resilient infrastructure, disaster preparedness plans, and adapting healthcare strategies to address emerging health risks.
I think part of our commitment with the Ministry of Health in trying to reach out to all our facilities and check the facilities, look at the welfare of the staff that we do send there to service it. And it's challenging, especially the island of Banga, coming to Banga Health Center and now Ravi Nursing Station. We've identified Ravi Nursing Station is you can say it's a new nursing station. And with the Banga, we encountered some issues with regards to the infrastructure, maintenance. I think it's been a while. And again, it's part of what the ministry is trying to improve on. It's the infrastructure, then things that goes together with infrastructure, the accessible to water, solarization or power, and to be able to do that and to allow them to carry out their work effectively to the community that they serve. And Banga, it's challenging because, as you can see when we went there, the effects of climate change, I can say, has really affected where the health center is situated, and we look forward to addressing this issue with the relevant authorities, so that, especially the Ministry of Waterway, so that they can take up to protect the health center. They need to protect the foreshore.
Climate change is really evident in most of our islands. So with looking into our facility, it really needed renovation and repair. And I'm quite pleased with that it's been included in our next quarter budget. So that's quite remarkable for feedback from our two supervisors.
Nurses on maritime islands play a vital role in providing essential healthcare services, often acting as primary care providers. Their responsibilities include managing emergencies, preventive care, and health education to ensure the well-being of island communities with limited access to medical facilities. The provision of a new outboard boat for Ravi Nursing Station will significantly enhance service delivery. This will enable timely response to emergencies, facilitates transportation of medical supplies, and expands their reach to other villages.
I'm very fortunate and to have an access with the service, providing services to my community. At Ravi, I've been serving this is my third year serving at Ravi Nursing Station, and I've got 5 villages and to look after, and also with 1 secondary school, 1 primary school, and 2 hotels. So with a total population of 1,012. I'm very fortunate and I'm very thankful that they able to donate 1 boat for the station and for the Ravi zone to ease the the medical services delivery to the 5 villages within my zone.
We are so thankful to the Ministry of Health that we have a boat, that they have given a boat. I think that's the need that all the villages, they wanted. When there's a sick person, that the boat can go and bring. Because these 3-4 villages, they're using this health center. And sometimes it's very hard to get a boat.
At times, our public don't have money, don't have fuel, and sometimes when it's during low tide, the means of transportation is really difficult.
Following the visit on the health facilities in Banga, the Minister for Health and Medical Services saw the need to improve infrastructure and working conditions for staff. This will significantly boost service delivery, providing nurses with the necessary support to deliver quality health care.
We are very thankful and grateful to our staffs, the doctors and the nurses, and the nursing practitioner here in Ravi Nursing Station for their commitment and their work in a very, very challenging environment, a very, very challenging situation. And the commissioning of the new MD Ravi will allow the nursing practitioner or whoever comes in next to serve in Ravi Nursing Station to better utilize and also reach out to the other villages and settlement that comes under Ravi Nursing Station.
And that was Nation's Business for this week. If you wish to watch the show again, you can do so via the Fiji Government YouTube channel. Remember, do join us again at the same time next week. Till then, have a productive week. Namo Manda.